Hello, my name is Dr. Joanie Winstead. I am a graduate of the prestigious Palmer College of Chiropractic in Davenport, Iowa. I am a board-eligible chiropractic neurologist with over 300 hours of postgraduate neurology through the world-renowned Carrick Institute in Atlanta, Georgia. I also have in excess of 150 postgraduate hours in functional medicine and metabolic testing through Apex Energetics. These classes include functional endocrinology, functional blood chemistry, neurotransmitters in the brain, and mastering the thyroid. As a member of Dr. Michael L. Johnson's neurology group, I confer with over 500 doctors on cases of chronically ill patients. Dr. Johnson is the author of What to Do When the Medications Don't Work, a non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I have been in private practice in Carthage, Mississippi since 2004. And you are watching this video because you or someone you love suffers from migraine headaches. I want you to know that headaches are not normal. They're a sign that something is wrong. Your body is designed to be free of pain. Feeling good is the normal state. Feeling the throbbing, pounding pain in your skull that won't go away is not normal. Neither is the nauseous feeling that comes whenever you go out on a sunny day or you see bright light. You lie awake at night praying your headache will disappear. You're feeling and looking miserable, irritable, and older than you really are. And then there's the frustration of knowing that your family and friends just don't understand what you're going through. So if you are one of the millions of Americans who suffer from annoying, pestering, mind-numbing headaches, then please keep listening, because as you are about to discover, headaches are not normal. When I discovered that 1 in 6 Americans are chronic headache victims, I nearly fell out of my chair. I couldn't believe that so many Americans suffer day in and day out when they really don't have to anymore, and chances are neither do you. That's why I've decided to step forward and produce this simple yet informative video. So please, for your own sake, carefully listen to every word on this video. It may be the most important message you will ever hear. Okay, let's get started. If you really want to get rid of your headaches and start living a normal life in a short period of time, then you need to first be aware of 5 headache relief misconceptions. The first misconception is that over-the-counter medication treats the cause of your headache. It's almost criminal that drug companies are hiding from you the fact that headache-relieving drugs don't actually target the real cause of your headaches. Here's the real deal. These pills cover up your headaches by simply disabling your brain's ability to feel your headache. That's why your headache comes back when the pills wear off. If you broke your leg and just took pills so that you didn't have to feel the pain would come back when the pills wore off. If these drugs actually treated the real cause of your headaches, then shouldn't your headaches go away permanently? Yes, they should, but they don't. These pills only sweep your pain under the rug. The real cause of your headache remains untreated, and that's why you keep suffering. And the second misconception is that headache medication can't harm you. Well, one thing many headache sufferers don't know is that the pills that they take are not 100% safe. In fact, a lot of side effects you may experience are far worse than the headaches you're trying to cover up. The side effects are sometimes not worth a measly 4 hours of relief from your headaches. You see, the way these pills disable your ability to feel headaches is by disabling a little hormone in your body that acts like a messenger to your brain. Of course, our bodies, being the highly tuned machines they are, have figured out how to use the hormones for more jobs than one. So if you disable the hormone from just doing one job, it will also not do all the other jobs in your body. And this can lead to all sorts of problems. You can get something as minor as a rash, or you can have a sudden liver failure or kidney problems. Even aspirin has been linked to deadly hemorrhagic strokes. And it gets worse. You see, the more often you take these medications, the more your risk will skyrocket. Also, medications seldom increase your body's ability to respond to stress appropriately, and it usually decreases your body's natural ability to fight disease. And the third misconception is headaches go away on their own. Tony Robbins has a saying, the definition of insanity is doing the same things and expecting different results. If you truly want to get rid of your headaches, then you are going to have to try something different. Something naturally, hopefully drug-free, and equally important, something that is proven to work. Obviously, you wouldn't have requested this free DVD if you weren't concerned about your headaches. So please, for your sake, don't drop the ball and not take action. The fourth misconception is that all doctors know how to treat headaches. There's a saying that goes something like this: if you're a hammer, all you see is nails. Hammers hit nails. MDs prescribe medication. Expecting a different approach from your medical doctor will only lead to disappointment. That's why I'm sharing this information to help headache sufferers like you. Now, before we go any further, let me stress to you that there is a place for medication, but more importantly, the cause of the problem must be identified. The wrong diagnosis will lead to the wrong care. And if your doctor's treatment fails, you'll probably get even stronger medication, or in an extreme case, your doctor will recommend surgery. Personally, I think there are times when surgery is the only option. In terms of headaches, there are natural alternatives that often work a lot better without the risk associated with invasive treatments. In fact, if you really want great results without all the risk of drugs, doesn't it make sense to try a natural solution first? And the fifth misconception is your problem is always where your pain is. Even though you may be feeling your headache in your sinuses or on the top of your head, that doesn't necessarily mean that is where the cause of the problem is located. For instance, people with a disc problem in their lower back will often feel pain, numbness, or weakness in their legs, even if there's nothing physically wrong with their legs. Sounds good, but why do I have headaches? Well, there are three parts to your brainstem, which include the upper, which is called the mesencephalon, the middle, known as the pons, and the lower, which is known as the medulla. Normally, your brain fires to the lower part of the brainstem, which is the pontomedullary area, which slows down the upper brainstem, which is the mesencephalon. But when the lower brainstem fails to receive impulses of firing from the brain, it fails to slow down the upper brainstem. When that happens, look out, because you've got a headache. There aren't any nerves in your head, but there are nerve mesh around the blood vessels. When the upper brainstem overfires, it causes the blood vessels in your brain to constrict and dilate very rapidly. This irritates the nerve mesh surrounding those blood vessels, and that's why you have the headache. I don't care if you've been diagnosed with cluster, migraine, cervicogenic, or whatever name that they have attached to your headache. To correct the problem, we have to slow down the overfiring of the upper brainstem. So let's back up a minute. Perhaps you're wondering at this point, how did my upper brainstem start to overfire and cause my headaches? I will give you the answer in one simple word: stress. Physical, chemical, and/or emotional stress causes the brain to decrease its firing to the lower brainstem. It could have been physical stress like a blow to the head in a car accident, chemical stress such as junk food or tobacco, or emotional stress of your job, relationship, or your finances. But whatever the stressor was in the past, you have headaches now. And the good news is that we know how to fix the problem. How do we fix headaches? Well, number one, we use oxygen. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of glucose and oxygen. We get the glucose from food, but as we age, our ability to utilize oxygen decreases. Scientists call this oxidative phosphorization. Oxygen helps increase the firing of impulses in your brain. If necessary, we run a CBC with differential, a complete metabolic panel, to determine your metabolic health. And if necessary, we use all natural supplementation specifically targeted for your body to provide you with the essential nutrients which is necessary to eliminate headaches. And the number two thing we do is we use unilateral adjustment. Everyone has heard that the right brain controls the left side of the body and vice versa. We only want to adjust you on the side opposite of the decreased brain firing. How do we determine which side is not firing properly? We do a thorough examination to find the problem. And number three, we may use other therapies such as auditory stimulation, which is listening to sound in one ear, olfactory stimulation, which is smelling different scents like peppermint or cloves, electrical stimulation, super antioxidant glutathione, or heat. The choice of therapy depends on what shows up on your examination. So if you're tired of dealing with the migraine headaches and you are worried about it getting worse, then fill out the information to your right and I will send you a free DVD that will show you how we treat our patients neurologically and metabolically. We will leave no stone unturned to determine the exact cause of your condition.